I want to like help people to not be afraid of data. When you say data and evaluation, people are like, "Oh no, I'm out of here." What I want to do is help bring color to data. Like data is more than just statistical analysis. That is important, but it's so much more than that. It can be pictures, it's stories, it can be whatever you want it to be. And disaggregating data is such a dire need in our communities and stuff like that, and giving people access to data that they need, but also showing them how to collect data.
Hey friends, welcome back to Public Health Careers. Today I had the pleasure of chatting with Michelle Bidwell. Michelle is the founder and CEO of Granted Advisors, as well as a PhD candidate in Community Health Sciences at LSU. She's an impact expert who specializes in grant writing, program planning, and equity-focused evaluation technologies. Michelle's passion for the field began at an early age, influenced by her upbringing in New Orleans and the impact of Hurricane Katrina. She conferred a bachelor's in psychology and chemistry at Xavier University of Louisiana. She then got a master of public health at Louisiana State University, and she will soon complete a PhD in community health sciences at Louisiana State University Health Sciences Center. In today's episode, you'll hear and learn more about how building a fundraising, evaluation, and grant writing skill set led her to founding her business, Granted Advisors, the importance of having empathy and equity-based evaluation practices in public health, especially when dealing with traumatized communities, how to choose a public health program based off the practicality of academic or practice-based professors, why organizations should strive for a culture of learning and how to cultivate that, and much, much more. Be sure to hit that subscribe button and leave a review. Enjoy today's episode.
Hello, my name is Michelle Lawrence Bidwell, and I am the CEO and founder of Granted Advisors, and welcome to Public Health Career.
Michelle, I'm so glad to have you on the show today. I'm looking forward to diving into all the experiences that you've had, getting your Masters of Public Health, and really learning about the consulting work that you are currently doing. So looking forward to the conversation.
Awesome. I'm looking forward to it as well.
That's awesome to hear. So before we get into anything, how do you identify and tell us a little about your personal background?
I identify as she, her. My personal background, I'm a New Orleanian through and through. I'm born, raised, educated, that's what I like to say, in New Orleans, Louisiana. And that experience has really shaped who I am today in terms of who I am on the personal level, as well as what I do professionally. So
Love it. Love to hear it, and look forward to digging into how that really shapes a lot of your perspectives and the work
yes.
that you do. So with your organization, Granted Advisors, you'll do a lot of work to support nonprofits in thinking about fundraising. What are some of the biggest challenges that you see nonprofits have when working around and getting fundraising?
I think one of the biggest problems that I see with nonprofits is not necessarily that they don't know how to do fundraising. I mean, a lot of that is storytelling, and who better to know their story than them if they're on the ground doing the work. But it's literally they don't have the time. A lot of these nonprofits have a small staff and they are in the community, serving the community, doing really important work that folks need. But at the same time, they don't always have time to go home and spend all night writing grants and doing grant reports. So, as I was working for a nonprofit and living in that experience and seeing my colleagues who worked at other nonprofits and seeing us all doing the same thing, going home and writing grants after doing work all day, I'm like, hey, this is a gap that needs to be filled. And so I created Granted Advisors to address that need.
That is a key point there. It's like it's not something they might necessarily want to do, they just mightn't have the capacity to do it. And then knowing what are those next steps to kind of take to really launch a fundraising campaign. And I also like the part of highlighting, like, it is the stories that really sell the fundraising. And it's like, how do we craft the stories to really sell and share that with people that care about the mission, care about the vision, care about the work that you're doing? Is there anything you'd add to that?
No, I think you said that perfectly well. The other side of the coin with that is evaluation, which I also do as well in my consulting capacity. And I think a lot of people fail to see the connection between fundraising and development and evaluation. And I'm here to help bridge the gap between that as well. It's so important because after you receive either grant funding or you do a campaign, people want to know what's the first thing they ask. Oh, what did you do with the money and what kind of impact did it have? And along the same lines as what I was talking about before, like, if you're in the field doing the work all day, you don't have time to do a grant, and you also don't have time to collect all the data and write a report on it either. So, that's really where I lie.
So how do you come in and bridge that gap specifically around fundraising and evaluation and like just showing the impact of the work that you are doing?
Yeah. So I think the best way to say this is my company, Granted Advisors. We are a full scale impact team. Like, so we come in and we not only help to, number one, educate the nonprofit or foundation that we're working with. We give them like a step by step strategy on how to do grant writing, how to do evaluation, leading kind of with the evaluation first. Like, if you don't have your mission statement, vision in line, that's where it starts. Because if you don't start with that, then you'll have and I could talk all day about this, like mission creep. You don't want to start getting grants for stuff that you don't even do. So evaluation is such a core component, in having a culture of learning is really what I do, is come in and teach a culture of learning, setting up the data systems, and then focusing on the grant writing and any type of fundraising support that they need. So, like, I guess we are a fractional impact team doing both fundraising and evaluation for groups that do amazing work.
I like the idea of culture of learning and just building that into things because many times we don't like if the frame of when we look at big organizations for Apple, for example, they spend billions of dollars in research and development and like really
Yeah.
evaluating what is going out there, and many times we don't think about, okay, how do we measure the impact of what we do, how do we invest into that research, into that development, into the implementation of new things that are going to grow the impact for the organization. I'm glad that there are organizations like Granted Advisors that is out there supporting nonprofits and giving them capacity to be able to do that.
Yep. Yep.
You also support a lot of nonprofits on grant writing.
Yeah.
What is the biggest challenge you see with nonprofits and grant writing?
I think the biggest problem that I see with nonprofits and grant writing is they have an amazing story, but it all lives in their staff's heads. It's not written down anywhere. It's not recorded anywhere. And so I really, or it's discombobulated in a sense, like, it's not put together in a linear way. So I guess the biggest issue that I see with nonprofits is they have issues with storytelling. Like, they know their stories, but they don't have the tools to put it together in a way that makes sense, in a way that will fund their mission. And that's really where I step in and help them to really make sense of their story and tell it in a way that is meaningful. They get to learn from their story because they get to see it kind of through fresh new eyes in a way that someone hasn't helped them put it together before. But also it helps to tell the story of their mission and the future, their vision, to funders that will be very interested in paying for the work that they do.
And a through line in a lot of work that you just shared about is like in the evaluation and the grant writing, in all of this, there's the story part of things and just how important that is to whatever the mission or the organization that you're doing. Outside of working with organizations to get that story outside of their head, outside of and put it on paper, what are like some of the tangible things that you work with organizations to really have and build out a strong story?
Oh yeah. So I have an interview, kind of like what you're doing with me right now. I sit down with them and I have an interview, and I kind of sometimes when I'm helping these organizations, you tell their story or helping them navigate their story, I'll use some of my evaluation background, so like I focus in equity centered evaluation and lots of participatory strategies. And so maybe I'll do like a photo interview or things like that speak to their story and help jog their memory about some of the experiences that they had along the way building their organization. So,
Absolutely.
yeah.
Well, I appreciate that. And pivoting us a little bit before we get more into your journey into public health, what does public health mean to you?
Wow. When I think about what public health means to me, I think it's two things. Number one, community, like just that community first model, making sure that we're building systems, programs, infrastructures with and for community at the center of it. Number one. And then the second thing that I think about is creativity. Um, I find the ability to really venture into my creative mode as a public health practitioner in the work that I do, and being able to teach folks about public health using the theories that are available to us in public health to create really like vibrant programming, effective programming. So, yeah, I think community and creativity are the two things that come to mind when I think of public health and creating these structures that aim to prevent things from happening to people, the things that make us sick and ill, even though, we have a lot of disparity in our communities and stuff like that. But how can we do better? How can we have an upstream thinking approach?
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career boosting events, connect with like minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in the description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. I appreciate you bringing in the creativity part of things and adding the community aspect, because I don't think we talk too much about the creativity or the arts that is public health, and just how it is not just an exact science. There is a lot of art that goes behind the work that needs to be done to prevent and promote health throughout communities.
Yeah.
So I was telling you before the show that I used Bing's generative AI, what's it called, Copilot, to like just look you up. And one of the things that it shared with me is that your passion for the field began at an early age, influenced by your upbringing in New Orleans and the impact of Hurricane Katrina. Would you like to share more about that?
Sure. Honestly, being a Hurricane Katrina survivor is actually what introduced me to research and made me hungry or like inquisitive about public health. So, when Hurricane Katrina happened, I was in ninth grade. I was a freshman. I was in high school for 2 weeks when Hurricane Katrina occurred. And I had a high school mind. I thought that, we were getting ready to go to football games, and, I got home from school that Friday and my mom was just like, "Hey, we got to evacuate." And I'm like, "What?" We've evacuated before. We live in New Orleans. Of course, we have storms all the time, literally have evacuation down to a sign. But this time seemed a little bit different, and that's because it was. My family moved away to a different town, and it was a long journey. A road trip that would have taken us about 8 hours ended up taking us over 24 hours to get to where we were going. A lot of the hotels and stuff that we stopped at were at full capacity. And, later on, weeks later, we learned that a lot of those places we stopped ain't there no more. Like they got completely destroyed. Thank God we didn't stay there. But anyway, we moved to a new city. Lucky me, I got to go to ninth grade for the first time all over again, a second first day. And on my first day at this new school, I can remember it like it was yesterday. I was pulled out of class. Um, and they sat me in a classroom, and it was with other kids from New Orleans. And then a group of folks started asking us a series of questions about our experience in Hurricane Katrina. And I felt kind of exposed. I wasn't ready to talk about it. I didn't really know a lot about what was happening back home because my parents were trying to protect us from a lot of what was going on and the fact that we lost our home and all of our things. And it wasn't until after that experience I learned that those folks were evaluators and they were doing a project about the youth who had been impacted by Hurricane Katrina or who were in the process of being impacted by Hurricane Katrina. So that really, I'm like, okay, well, what's an evaluator? And like, what is this? And like, what type of projects, that really kind of piqued my interest. And I just started, you know, paying more attention to when people talked about research and things like that. And like, years later, I decided to go to college and I hadn't really discovered public health yet, but I knew that I had a health focus and I used that to apply and that vision to apply to school. We have to write an essay and all that. And I really just, that experience of going through Hurricane Katrina, number one, seeing the impact it had on my community, having to have my community be rebuilt, and then that experience of being interviewed or questioned in a very extractive way about my experience really helped me see what I wanted to do in my career and kind of shaped my trajectory, honestly. So that's really what led me on that path.
Well, firstly, thank you. Well, firstly, I'm sorry that happened and the trauma, and I could imagine what I could only imagine, I should say, what that looked like. And I'm glad from that experiences that you were able to get a better understanding of health and like just shaping that you wanted to do things that impact community health and figuring that out. And as you was talking about the people asking you questions, all I'm thinking is like traumatizing. Like how can they just come in and just like ask that? And I'm thinking about how can we really create better ways to collect that information and really protect people from the trauma that they have just faced, their families have just faced, their communities are facing. Because and I could imagine like that in itself was probably something in the embodiment of, while this is cool and they're doing this cool evaluation type stuff, there probably was a better way to do
Yeah,
that and to really, as you say, like not be extractive, but be supportive to the people that you are trying to get information from.
right.
So that happened in ninth grade. You decided to get your bachelor's in psychology and chemistry at Xavier University of Louisiana. Tell us about
Yes.
that thought process.
Yes. I really, when I was in high school, I found that I was really gifted in psychology of all things. Like I took a psychology course and one of my professors, he's so dear to my heart. He challenged me. He was amazing. Like he made us write like essays on Thoreau, like things that we had never talked about. I didn't know anything about until I had met him. But he signed me up to do like a competition, a statewide competition around psychology. I guess he saw too that I was really interested in the subject and doing well in his class, and I won the local, like the city competition, and then he signed me up at the state level and I won that too. And I'm like, hey, I think
Hey.
I'm good at this. I think this is a talent or something. So when it got time to apply for college, I knew that I had that health focus. I knew that I wanted to do something in health, and psychology was a major. So I wanted to go the psychology route, and I actually wanted to go to medical school when I first went to college because I hadn't discovered public health as we know it today at that time. So I went the pre med track, and that was the chemistry and psych focus.
Well, shout out to you for winning those competitions. That's
Oh,
dope.
thanks.
That's dope.
Thank you.
First of all, and I'm glad like that really like showed you that you could do like this work and like guided the path into you going into college. Many of us, I'm also pre med, recovering pre med, I guess maybe I
Yeah,
don't
recovering. I love
know.
that.
uh, but I think it's just important that like there's some sort of direction as we're going, and then from there, then I think like you sharing your story today and just really understanding is like there's so much that we can do in public health. Public health intersects in so many ways. There's so many ways to get involved in public health. So I think like getting people exposure to public health as early as possible is most beneficial. So with that, I say thank you for being on the show.
Thank you.
And then yeah, of course. And then while you were in your bachelor's program, you were a pharmacological researcher at Louisiana State University School of Medicine. Tell us about that experience.
Oh my God. When I tell people about this experience, they probably don't believe me. But when I was in college, my mom taught at a school, and one of the students' parents was the head over the pharmacology department at LSU. And so one day I was there with my mom, and I just got to talking to him, and he was like, "Hey, do you want to come intern in my lab?" And I'm like, "Yes." So I started interning in the lab, and like I was a part of some really cool experiments. We did multi-schedule testing on rats, and we were basically testing the impacts of street drugs on the human brain. So we work with drugs like MDMA, heroin, cocaine, you name it. Alcohol, ethanol. We were doing schedules to really see the impact that these pharmaceuticals had on the human brain. These chemicals basically had on the brains of these rats, and how it would translate to human subjects. And that's really what we did, and it was an amazing experience. The lab that I worked with also, even I can remember one time, like what is like the federal agency that does the drug administration, the FDA. They would come
FDA. Mm-hmm.
they would come into our lab sometimes to test like drugs, like to weigh it for like trials. So that was a cool experience too, to be like, oh my God, I got to see a lot of really different cool things and work with some really great scientists over there. And it gave me a great respect for pharmacologists. I knew I didn't want to become a pharmacologist, but I think that it really lent well to my background in psych to be able to see how substances impacted behavior. So
And what did you enjoy most about like the bachelor's in psych? What did you take away most about from that?
oh my God, I think what I enjoyed the most is just learning how people think. I think that was the thing that I took away. Like, how do people learn? Like, the psychology of learning was really something that I like literally use to this day. Like, the different ways people learn. Like, some people are auditory learners, some people are visual learners, and I think that really helps me. Like, literally now, like that I'm doing fundraising, development, and evaluation. When it comes to reporting on outcomes of the storytelling, when you're writing a grant, like I feel like I know a little bit more about what connects with people. So I think that was something that really stood out to me. And I can remember the class that I took. It was literally called the psychology of learning. So if there are any students out there listening, take that class, because it's pretty helpful in your career, but also in your personal life too.
Awesome. Well, thank you for sharing that. And overall for undergrad, were there any big takeaways that you had?
Yes. One of the biggest takeaways that I had is actually another story of how I discovered public health. I told you I wanted to go to medical school. I had taken the MCAT. I like had my 10. They tell you to like apply to 10 medical schools. I'm like ready to go, right? I had an uncle who was like, Michelle, have you ever shadowed a doctor? I'm like, no. He's like, well, how do you know you want to go to medical school? Because I know, like, I just know I want to go to medical school. So he set me up, and I shadowed a doctor, and it was in the emergency room. And yeah, I decided that I did not want to be, that wasn't for me. There are people who are gifted, and that's their calling. And I'm so thankful for the positions that we have. But after that experience, I knew that that approach to helping people wasn't for me, and it set me on a path to doing some research online and figuring out what was, and that's when I found public health.
Love it.
Yeah.
Love it. And I think that is a big note to anyone that's interested in doing any kind of work for their careers. Like,
Yes.
shadow someone, get some experience in it, because you have an ideal vision of what that looks like, maybe from like Grey's Anatomy or whatever the case might be. But really ensuring that you're understanding what it actually means and if that's actually the type of career that you want to do.
Exactly. Like shadow
So
someone. Like whatever you want to be, find that person, reach out to them and shadow them.
so from that discovery that medicine was not for I have here that you got your master's of public health in behavioral and community health sciences at Louisiana LSU
Mhm.
Health Sciences Center. What was that the from that shadowing experience to realizing that public health was a thing to applying and getting accepted to the MPH program? Tell us about that.
Yeah, so like I said, I was like in my senior year, I had graduated, right? I graduated from Xavier and I knew I didn't want to become a doctor anymore, but that was a real revelation to me, right? Because you start looking at medical schools like in your junior year. So that I mean, it kind of messed me up in a little bit. I was like, not, mentally, I was like, oh my God, what am I going to do? And then I found public health. And so I started to applying to public health graduate school programs. I took a year between when I started graduate school and when I graduated from undergrad. And I just took the time to really dig deep into school culture and what would be best for me. I looked at I think, and if I could give anyone advice, this is what you should do when you are looking at attending a graduate school, like go on their website and look at the bios of the different professors and see if there's anybody that you align with or have a connection to and reach out to them. Don't be afraid to reach out to folks because 9 times out of 10, no one is reaching out to them because everyone's scared because everyone's scared to think that they won't respond. So the one brave soul that does reach out, the people love giving folks advice, so they'll reach out and they all want to help you. That's their whole job is to help the students succeed. So that's what I did. I applied, of course, to LSU, and I applied to some other very popular programs around the country. And I did get into those other programs, but ultimately I chose LSU because family is really important to me, and I knew I wanted to continue to be close to my family. And the culture at LSU, after taking a tour and reaching out to those professors that I saw alignment with, and they were very honest with me about the program. And what would be expected of me, and I just knew it was a good fit. So I decided to go there.
Do your research, really figure out like what it is you need in a program, and then work backwards to get programs that support that. And like to your point, like if family and something like that is important to you, like ensure that you're choosing schools that are close to your family.
Yeah.
Um, So while you were in your MPH program, you were an assistant program coordinator at the Louisiana Cancer Prevention and Control Program. Tell us about that.
Yeah. So the story of how I got there really started beforehand when I was researching and I reached out to one of the professors at LSU who was over the Louisiana Cancer Prevention Program. And that's a really unique thing that really drew me to LSU because a lot of their professors, they are professors, yes, but they also have full-time jobs running a lot of state programs or like big nonprofits. And I like that because I knew that they would be able to teach me from a theoretical sense, but also like a practical sense. And I knew I needed that. And so one of the first folks that I saw and I knew that I would connect with was my now chair. She's now the chair of my doctoral committee. But I saw that she was over the Louisiana Cancer Prevention Program. And my mom is a cancer survivor. So I reached out to her and I led with that storytelling again. I told her my story about having a mom who survived breast cancer and what that was like for me as a young child, even before Katrina had happened. And me and her were able to really connect about that. And she gave me an opportunity to work with those young breast cancer survivors. And I mean, I was so passionate about it because my mom was a young breast cancer survivor. And if you know a little bit about, young breast cancer survivors, a lot of it is genetic. So I'm also in a place where like I'm, more at risk for it as well. So that work was very passion forward, being able to use things that I was learning while in the program in real time in the capacity of my work, whether it was helping to formulate grant applications, leading support groups, doing evaluation work. I was able to like apply what I was learning in real time.
That's awesome. And I think goes back to the point that you highlighted is do research on the school, find out about the professors, reach out to them. And to your point, like not all schools are going to have professors that are both academic and
Yes.
practitioners. Many schools would like oftentimes have just people that are in the academic realm. And like to that point, like if you want to go into academia, if you want to do like that heavy type of research, then there's access to that. But if you want more practical experience in working in organization, not public health organizations, it is the onus on you to like reach out and do your research to see, are there professors that are connected to organizations that I can intern at while I go to the school? Because very similar to that's how I got my first internship. A professor was a CEO for a nonprofit in the
Hmm.
region, and he was offering internships, and I took that internship, and that was very, very beneficial to me. And I also very much appreciate the perspective of practitioners that come to teach in MPH programs, because um, it just is very practical, and you can ask them like very questions on like what's going on with the organization and things like that. The things that I don't think a lot of the academic professors can give you like real tangible feedback on. So I appreciate you raising that up.
Yeah, exactly. What you're saying is so true. Like, I can't remember a class that I had that, like, we didn't learn about the theoretical thing, and then it was backed up by a real life case study of something that they experienced in the field. And, like, I think that really made the difference for me.
And were there any big takeaways that you had from your MPH program?
Yeah, like, get close with the professors that you see have a lot of alignment with what you like, what you want to do at post graduation. Like you just said, if you know that you are more interested in academia, start talking to people who are in your program who are doing the type of research that you are interested in, so that they can help you or become a stepping stool for put you where you want to be. Likewise, if you want to go the more practical route, you want to be a practitioner, make sure that you are connecting with folks in the program that are doing the type of work or in that type of space, so that they can help connect you to, because even if they themselves aren't able to connect you, they will be able to connect you with someone who will ultimately will. And one of the most important questions that has gotten me so far on my journey is there anyone else I should be talking to about this? I mean, that question alone will take you so far.
Absolutely agree with that 100%, because more likely than not, they're always going to refer you to someone
Yep.
that is going to be someone that is of interest. And as we will find out in public health, is like you're only 3 degrees of separation away from many people that are working in jobs or positions and organizations doing things that you want to work with. So like you never know how close that network connection is. So
Exactly.
yeah. And you are almost finished with your
Yes.
PhD in community health sciences at LSU. Tell us about that thought process going from your MPH and thinking through, okay, I want to get a doctorate in public health.
Yeah. So when I was in my MPH program, I didn't necessarily want to go get a PhD. I had some trouble seeing like what I would do with a PhD in public health and things like that. But over time, talking to those mentors, I started to really see how it could really take me to the next level. Like might have even been the difference between, being in a director role or a president role or a CEO role in some of these organizations. And I knew that that's the track that I ultimately wanted to go towards. And so I ended up deciding to apply for the PhD program. And from there, I was able to get internships during my PhD program, which actually led me to my first full time job, my big girl job in public health at a nonprofit foundation as a director while I was still in my PhD program. So, like I said, that networking stuff is really everything.
And talk to us about that progression from working as an intern to going to, I believe, it's Director of Impact and Evaluation at Baston Community Resilience.
Yes. So when I first started my PhD program, my chair, who's my chair right now, she came to me and she was like, "Hey, Michelle, there's someone I want you to meet." And I was like, "Well, what is it?" And she was like, "It's an internship program. I want you to do." and I want you to meet the CEO of this, the executive director of a nonprofit. And I was like, well, okay. So I went to go meet with him, and he was great. And he told me all about the nonprofit. And it's so funny. You had to have been there. The way that he was describing it, as if it was already there. We were at a meeting space, like at a co-working office, talking about the vision for this nonprofit, and I thought it was already a flourishing thing in existence. And so he was like, well, let me come show you. So I got in the car with him, and we drove over, and it was just dirt. Nothing was there. Nothing was there. But I believed in his vision so much, and I knew what my chair was thinking, because she saw the thorough line of how well I was able to connect with people who have been through traumatic experiences because of my traumatic experience in Katrina, and then also working with breast cancer survivors, young breast cancer survivors. At that, she saw how I handled everything with tenderness and care that people needed, how I went about data collection and things like that with them because of the experiences that they had been through. And so she knew that this would be a good fit for me, working with our veterans who had been through some very traumatic experiences, serving our country, a lot of them who came back with visible and what they call invisible wounds of war, which is very real. And in that capacity, I started as an intern, and I was writing grants for them. Amari had never written a grant before in my entire life, before I started working at Baston. And I mean, now, what is that? These so many, almost 7, 8 years later, Baston is thriving. They have a lot of families that live there now. And I helped them raise like over $6 million to become what they are today. And I created their evaluation infrastructure in a way that is equity focused and empathy focused, because they've been through a lot.
Well, that is awesome. Shout out to your chair for connecting you into that position. Shout out to the executive director having a vision and communicating that so excitingly that you were actually like, all right, this guy is not crazy. I'm gonna follow through with this, and really seeing the impact in that. And I loved that you're highlighting like not only the hard skills that you're getting there, but the soft skills, like realizing that your chair saw that you were able to appreciate and be tender and soft and know how to communicate and interact with people who have been in traumatizing situations, and how valuable that would be to this kind of organization and the work that they were doing. And these are the kinds of things you can't necessarily teach people, but oftentimes people see this and they gravitate to it. And for certain jobs in public health, it's very essential to have these types of soft skills. So I appreciate you sharing that. You shared that the evaluation model, and I think I'm going to mess up the word, so I'm going to let you share more about the evaluation model and why it was empathetic and something else, I think was the word you used.
Yeah, empathy and equity focused evaluation. So I still use all of these approaches now, and when I was started working at Baston, there wasn't a whole lot of theory or like a lot of research that I had access to at the time to develop Bastion's evaluation. But from what I could find, I just really read up on like participatory research and things like that, and I just applied a lot of those methods to what would be needed in evaluation. So like if you are creating a survey for folks, like let them read it first. Let them say like how we can like does this question even make sense to you? How could we word this question better? What other like answer selections should we be adding in this type of survey question? Or, if you're developing an interview guide, you want to interview folks on their experiences, let them read the questions first. Like let them say like what they want to answer, what they don't want to answer. Paying people for their time. They should be given funding. Some people, they do better with different types of evaluation, like art-based evaluation and things like that. So those are the different theoretical and methods that I really looked into when I was developing Bastion's evaluation system. I talked to a lot of other evaluators. Bastion is what's called a community intervention. And there are some other communities around the country that are like Bastion. So just to give you a little bit of a background, Bastion is an intentional community where the veterans who live there live side by side with civilians, and they all work for the common purpose of creating a better community for all. like even from the infrastructure of the community itself, like the homes are facing each other, so when you walk outside it's supposed to maximize interaction. So like everything about the community is created to intentionalize the community being the first intervention if a crisis ever occurs in anyone's life. And so there were other communities around the country. And when I was creating Bastion's evaluation, I would call them. I've even been like to Oregon to talk to some folks, and they're like, "Well, we haven't done evaluation yet. We haven't done an evaluation on this community." So it was interesting to talk to them to develop the community, but also the people who were going to be living at Bastion as well. And so, like putting the community first, even in the planning at the planning stage, the evaluation question stage is what you really want to do, and that's what we did when we were building Bastion.
And you've mentioned your chair quite a few times in the interview. And before I ask the question, I just think like it's so important for people to really think about who is the person that is going to be their chair while they're doing a doctoral program, because oftentimes can make and break the experience. For you, it was someone that guided you into a PhD program, connected you to someone at an organization that allowed you to get a director role and get that like high level experience. Talk about the importance of having a good chair.
Having a good chair is almost, I mean, words cannot express how important it is to have a chair that you mesh with. Someone who's gonna put the pressure on you when it's needed. Someone who's gonna be with you and stick by you through bad times and good times, because going through this is a multi-year experience. When you're going through graduate school, you have ups and downs. My chair has been with me through like getting married, buying my first house, having my kids. She has been with me every step of the way and helping me plan and mitigate strategies to help me stay on track and still be able to graduate through all of those life changes happening in my life. I mean, through getting into a full-time career, getting to a level where I was actually a vice president in an organization, and now like owning my own company. She's really helped me navigate all of that, introducing me to the people I need to be introduced to, just a sounding board. I mean, she's been everything. And words can't express how thankful I am for her. And I know a lot of people don't have that experience with their chair, but if if there's anyone out there listening to this who is thinking about going the PhD route, know that your chair is one of the most important decisions you're making, with the exception of like your actual topic for your dissertation, that you'll have to make.
Thank you. Great insights. And I think that can't be understated, just because all of the rigors of a doctoral program, along with the other things, having someone that is really meshing and there to support you in ways can really be important in driving you forward. So you mentioned that you were vice president of strategy and operations at Acceleraise. Tell us about that work that you did. How'd you get there, and what do you do in it?
Yes. So after working at Bastion for several years, I got to a place where there were folks at other nonprofits who would come up to me and they're like, "I see y'all are getting a lot of grants," or like, "I see y'all are able to collect data and things, like, what are y'all doing?" So I actually started my company, Granted Advisors, while I was still working at Bastion, before I even started working at Acceleraise. But I knew I got to the point where I was like, I really want to be able to help many different nonprofits at a time, and not just Bastion. So I met the founder and CEO of Acceleraise. Amazing. I love her so much to this day. She's still a really important person to me. And I met her and I was like, "Hey, I think I want to go and do my own company." And she was like, "Well, I already have a company, and we have a similar vision. You should come over here and help me." And I, weighed the options. I was a new mom at the time. I had my kids are 14 months apart, and they were both under 2 when all this was happening. So finding Acceleraise was I think it was a really good point in my life when I found it, and I said sure, and I joined the team, and I helped build Accelerate a little bit. I helped build them while I was there, and it was a great experience. I learned a lot while I was there. I have nothing but positive things to say, but yeah, that's what took me from Bastion to Acceleraise, is that I wanted to help more nonprofits. And it's actually a funny story. When I was leaving Bastion, they were like, well, where are you going? We really want to keep working with you. And I was able to bring Bastion on as my first client at Acceleraise. So
That's
yeah, I learned a
awesome.
lot about negotiating and things like that through that process as well.
Understandable, and I think like that speaks to the point that like so many people think about like competition, but there's so much value in collaboration, in learning from the work that other organizations are doing, and especially as you're thinking about like entrepreneurship and public health. Many times we are working jobs and we just do the work, but we're not doing the back end work of having to get clients and get sales and get
Yes.
contracts, and that's a lot of the work that goes into building a business. And you could imagine how challenging that could be. Two under two, new
Yeah.
mom, working, doing a PhD program, all those things. And I think like to the point of like it helped you understand other aspects of the business that would have been able to transfer to Granted Advisors as well.
Exactly. Working at Acceleraise really keyed me into a lot of things that I wasn't prepared to do it on my own. I didn't know enough. But working at Acceleraise, I learned about contracts. I learned about HR. I learned about health insurance. I learned about, the back end and working QuickBooks and all those things that I had no idea about. I was able to learn them there.
And what were the main roles and responsibilities that you did at vice president of strategy and operations?
Yeah, so operations, like whenever I helped build out like a HR structure, I helped with like I said, health insurance, contacting the health insurance company, making sure that the other employees were set up with their health insurance, meeting with other employees, getting them trained up and started in their new roles, onboarding and offboarding, those types of things. And I also had clients of my own, so I was also a consultant as well. So a lot of internal management, training people up, encouraging people, sending out invoices, all that type of thing. That's what I used to do.
Sounds like you're building a lot of skill
Yeah.
sets and a lot of transferable skill sets that could be used across a lot of ways.
Yeah, I think one other thing that was kind of unique that I got to do while I was at Acceleraise is I helped, like Acceleraise was going through a branding change, so I was able to help lead that as well, like the vision for the new website, the copy on the website, pictures and photo shoots and all that kind of thing, and that was a really cool process to be a part of.
And I guess insights into that. What are there any like big tips you share people that are thinking about rebranding and things like that?
Oh, yeah, don't do it on your own. Hire a expert because you're gonna spend that money doing it on your own, and then you're gonna be like, wait, this kind of sucks, and then you have to spend the money again to hire an expert. So, number one, that number one, that, and then the second thing is, I guess I didn't really see, how amazing like creating your own stock photography is, like having a photographer come in and really set a vision and do a series of like photo shoots so that your organization can have their own stock images. It really makes a difference.
That's real. That's real. I know the organization I work for. We recently went out into community and took like a bunch of pictures with different organizations. Because yeah, it really does help to
Yep.
capture a lot of that brand and the vision of what you are trying to do.
Yep.
And you shared that you started Granted Advisors before becoming vice president of strategy and operations. Tell us about the thought process of starting Granted Advisors.
Yeah. It's really a short story. It was literally New Year's Day 2020, before the pandemic started. I had my newborn son on my lap. He was 2 months old, and I was writing some grants. And at the same time I was writing grant, I had got an email in that we got another like another six figure grant. And my husband looks at me, he was like, Michelle, like, you're really good at this. You should start a business. And I'm like, no, I don't know how to do that. And he was like, it's really easy. All you have to do is go to like the Secretary of State website and just sign up. And I'm like, wait, what? Like, I didn't realize it was that easy to make a business. And so like literally that day we went and signed up. It took us like an hour or two. And I started just like that. That's how I started my business. And then from there, I told you I had people from other organizations that would contact me and ask me to help them with grant writing and stuff like that. So those same folks that have been contacting me, I just sent them an email. I was like, hey, I started a business doing grant writing now. These are my prices, and it just started from there.
Love that. And I think it's important as well to realize, like, you're doing the work, you're getting the result, you have the skill set, the outcome to do the work, to say, okay, I'm going to start a business and do this, which I think is something I think maybe people don't think about enough before going into consulting work, but it's very important to be able to be an expert in whatever it is you're trying to consult around.
Yeah.
And we spoke a lot about evaluation, grant writing earlier, and the work that you do with Granted Advisors. I know, well, I read on your website, equity-centered methods, and I really wanted to hone in on that and like wanted you to explain more about how you all materialize that in the work that you all do.
Yeah. So there's multiple different ways that I like to center equity. And like I said before, a lot of it stems from my personal experience, like through Hurricane Katrina. And I know how I felt when I was in that seat being evaluated, right? My mission is I don't want anyone to ever feel like that ever again. So whenever I create evaluation projects, that is the lens that I put on, making sure that people feel supported and a part of the evaluation process when they are being evaluated. And that's really the lens that I use to create strategies for my clients as well. So when you think about putting equity first, it's like empowering people, centering them, and putting them in a seat where they are the decision maker. So a lot of it is education focused. Here are the steps to evaluation. Like, do you know what an evaluation model is? Do you know? And, it's one thing to go in and just be like, okay, here's an evaluation, go ahead. This is it. And it's another thing to put education first and teach people about why evaluation is important, how they can create a learning culture using the data they can collect, and how you can utilize the data at the end of the day. Whether you want to use it to tell your story on social media, whether you want to use it for grant writing, there are so many ways that you can go about centering the community through this work. And so that's really what I try to do. And it's so important, especially here in the Gulf South, where, sometimes it's a push. People are scared when they hear equity, but I don't care. Like, we have to stand up against it and talk and continue to talk about it, and to continue to talk about what equity really is, and making sure that people have the infrastructure in place to collect quality data, to challenge standards of traditional rigor, and to be able to tell their stories in the way that is most authentic to them. So, and that's what I support folks in doing.
I love how you center your own experience in how you want to show up for others, and kind of like how we highlighted before, like the traumatizing way that research can be done, and really building in participatory ways to be alongside communities, supportive, and really ensuring that people are all safe in when they're sharing out their data and their stories with researchers and doing that work. So shout out to you for doing
Thanks. That. Exactly. And like, just to say one other thing, I want to like help people to not be afraid of data. When you say data and evaluation, people are like, oh no, I'm out of here. What I want to do is help bring color to data. Like, data is more than just statistical analysis. That is important, but it's so much more than that. It can be pictures, it's stories, it can be whatever you want it to be. And disaggregating data is such a dire need in our communities and stuff like that, and giving people access to data that they need, but also showing them how to collect data. It is also very important. So.
Absolutely. Disaggregated data is a huge equity topic. And I hosted a panel recently and they were saying like whoever holds the data holds the power. And I think that that is very, very important in so many aspects. So yeah, really, really creating those ways to give
Exactly.
people back power by giving them their data. So I know we spoke about quite a few things that you'll do with Granted Advisors, evaluation, grant writing. Is there anything that we are missing that you'd like to highlight from the work?
For sure. Another thing that I've been doing more recently, like in the last 2 years, is doing things like this, being on podcasts. And I've also been asked to speak at a couple of conferences and doing workshops with folks in education. And so, education, when I first started my business and started working, wasn't something that I thought about on like a major scale in terms of like outside of just talking with my client one on one and teaching them and training them up on evaluation and grant writing. But now I'm seeing like how this is such a need. If you think through my public health lens, I'm seeing that this is a need at a community level. So right now I'm thinking through different strategies where I can share learning to a broader audience, whether it be through social media, through podcasts like this at conferences, and also, of course, I'm in the process of developing a course for folks who may not be able to afford like a full time consultant or a fractional consultant, but they do have time at the end of the day to like learn a skill that will be able to help them, whether it be in a nonprofit or if they want to start a business of their own doing this type of work.
Okay, that's awesome. And on the core side of things, is that focused on nonprofit leaders and what specifically? And I'm guessing I don't know if you've like drafted anything as yet, but just yeah, well, tell us more about that.
This course is really targeting for anyone who wants to learn about grant writing and evaluation. You don't have to be a nonprofit leader. You could be a college student who's just literally in, like you want to do this in your career. You want to start a grant writing company, or if you want to like work for a grant writing consulting firm, you can take this course and learn these skills that may not be taught like one on one in a graduate program. Like I remember in my graduate program, we took a grant proposal writing course, but it was for like big academic federal grants, which is important. But there's a lot of foundation and corporate grants out there that we didn't really learn that much about. But most of the funding that I was seeing in the nonprofit world was coming from those corporate those corporate grants and those foundation grants because like I said before, a lot of those nonprofit staff, their staff doesn't have the capacity to write a large federal grant, number one, and they darn sure don't have the capacity to do reporting on one. So just along the way I've just picked up the major challenges were for these folks, and the course is really about that. So no, you don't have to be a nonprofit professional, even though it will be very valuable most valuable probably for nonprofit professionals, but you don't have to be that. Anyone who wants to learn about this skill set can do it. Even if you have a for-profit business, there are grants available for them too, and a lot of the things that you'll learn in the courses is just as applicable.
And if people were interested in learning more about the course, when it's going to be released, where would be the best place to point them for that?
Yes, if you want to learn more about the course or just me in general and Granted Advisors, you can visit us at www.grantedadvisors.com or on our social media, whether it be Instagram, LinkedIn. The tag is at Granted Advisors.
Awesome. I'll be sure to link that in the description, or if not in the description, in the show notes. So I'll be sure to click through and check that out if you're interested.
Thank you.
Yeah, you're most welcome. And then last question that I'll ask you, and I guess last question right now on Granted Advisors is, you've had this business right before the pandemic. You've been going through your PhD program as well. Just on the side of the business, were there any things you wish you knew earlier on or anything like that?
Yeah. Just like I said, like we talked about before, I'm a recovering medical student, a recovering person who wants to go to medical school. I'm also a recovering perfectionist. And with that perfectionism came me wanting to do everything on my own. And one of the major things that I had to learn becoming a business owner is I cannot and shouldn't do everything on my own. So, I had to learn what proper delegation looked like. training people up in how I like my business ran, my moral character and integrity standards here at Granted Advisors, and bringing in those key folks onto my team that could help me and do the best work for my clients. So, if I could say anything else, that delegation is number one. And I mean, I didn't have a choice, right? I have a family, and so I have to be a good delegator, and that's what I really learned.
Yep. That definitely is a lot of what the business side of things takes when you're running it, right?
Yep.
So before I move you on to the Furious Five, Michelle, I would like to ask you, where can people connect with you, and where would you like to see yourself in the future?
So you can connect with me, like we talked about earlier, through Granted Advisors or my social media, especially LinkedIn. People have been sending me messages through LinkedIn. I like having those conversations. So if you have any questions, feel free to reach out to me on LinkedIn. And where do I see myself in the future? That is such a good question, and I think it has recently changed. I think I want to be uh, more of an advocate and an educator as we go into the future. I want to continue, of course, doing my one-on-one consultant work, but using more of that public health approach in my business, reaching communities of people or communities of practitioners instead of just that one-on-one.
Well, we look forward to seeing how that unfolds for you. And there was one other question that came up in my mind, and it's generally, so what makes you most excited about the work that you do at Granted Advisors?
The thing that makes me most excited about the work that I do is seeing the results in real time. I mean, there's just nothing that can compare to that. Like when you are working with an organization and you're helping them bring in money and you're seeing the money go to work because they're able to buy new headquarters or buy all this new equipment that they weren't able to have before, or they're able to serve 200 more people a year. I mean, that is really what does it for me, to be able to see in real time and like go to their office to have a meeting and see everyone that they're serving. I mean, there's nothing that touches that. Um, and that's why I do this.
Well, keep on doing the good
Thank you.
work. You're most welcome. And then moving on to the Furious five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Find a mentor and and stay with them. Even if you have to pay for a mentor, find a good mentor and stay in connection and community with them. Ask them all the questions. Don't be afraid. And ask them that one critical question that I said before. Who else should I be talking to about this? Like, use that question.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
If I was talking to a person in my position, I would tell them that it's not going to happen overnight. Um, there will be bumps along the road. Make sure that you have a community of support around you who is supporting you to be the person that you believe you're called to be. Your community is so important. So don't give up. Have faith. Get those mentors, and and everything will work out.
Number three, what's something you are working on improving in your life?
My time management. I'm working to improve that. I feel like I'm much better at it this year, but there's always room for improvement. Um, yeah, time management.
Number four, professionally, do you recommend anything?
Professionally, uh, yeah. Uh, always read. Like, there are so many great books out there that have made such an impact on my career. Um, you know, be an avid reader, be an eternal learner. Like, you'll never get to a point where you know all the things. There's new data, new evidence, new methods coming up all the time. Like, subscribe to all of the academic journals that you can, all the circles, like public health careers. Like, stay up to date on those things. Read every day to make sure that you're up to date on the best and and most effective strategies for things. And join a lot of organizations like like for me in my world as in an evaluation world, there's AEA. Like join those organizations, those big large groups, because that networking is just invaluable, and attending those conferences and stuff makes a world of a difference. Like there's an American Fundraising Association as well I'm a part of. Like you make sure that you're joining all of those type of groups.
And I will link those in the show notes as well. And number 5, if there was one piece of advice you'd give to your younger self, what would it be?
Oh, that's a good one. Have faith. That's what I would give her. The advice. Don't give up, have faith. It'll all work out for the better.
As it is working out for the better. Thank you, Michelle, for coming on and sharing your story. It was a lot of fun to get to learn more about the work that you're doing and building with Granted Advisors, as well as your path to getting there.
Thank you so much, Amari, for having me. I really enjoyed my time, and I hope everyone learns a lot.
Yeah, they absolutely did. And congratulations on almost finishing your PhD program and becoming Dr. Michelle Lawrence Bidwell.
Thank you. So soon, yes.
Yeah. Look forward to seeing pictures or whatever the case might be. Awesome. Well, housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to hit the subscribe button if you made it this far. Leave a 5-star review and share this interview with a friend. Greatly appreciate it. I will see you all next week. Peace, everyone.